one interesting aspect to it, this adult conversation, is erectile functionality. So as people improve their blood flow, it's no surprise that in males, you would have improved erectile functionality. But what's really interesting is that improves to a point that an erection is not only really hard and firm, but it also starts to bounce. So in males, they see this little, my client patients get this little bounce, and then pretty soon it gets this massive bounce with every heartbeat. And that is a visual optic that you're really improved your blood flow. And young males, like 15 to 20 or so, will have that. And then it gradually goes away. And if you're listening today and you're 50 or 60, you had it. You just forgot it. And it just gradually disappears. And you want to have that kind of a maximum blood flow. So paying attention to functionality, appearance is really important to your health. Nobody talks about it. And social media, hosts like yourself play a huge role in introducing these important areas of science that would otherwise, Thomas, never be communicated to the average person because it's not taught in medical school. The metrics that we are taught in medical school are, what is aligned to CPT coding and revenue and chasing disease and treating disease. But I heard this one interesting saying, well, if medicines really work, why do you have to keep taking them? And so really, it's the notion that we just permit disease to continue. But when you get rid of these damaging inflammatory fat, in every form of chronic disease we studied in 6,000 Americans, we saw every form of chronic disease either substantially improve or go completely away when you eliminated visceral fat, muscle fat, deep subcutaneous fat, and heart fat. So I think it's really these are really important metrics. So I'll show this one because the fourth area of fat we haven't shown is this fat around the heart. So here's this. This is a very interesting study. This guy came to me in July of this year. Now, this is his right lung, his left lung. He's got a lot of fat in his muscles. This is actually visceral fat starting to pop up in his lung space. And between his right lung and left lung is his heart. Now, notice this big chunk of white around his heart. That is heart fat.